A lot of times when you got that, it's not
Yeah,
real long.
yeah, no, Clara told me that. I was sorry to hear that, but,
So. Somebody, you know, when you're, he was a teacher for many years, let me know and we'll certainly consider them, so.
Jacob, mine is not connected.
Just like, oh, she's got a big stick back there. You're the one she can reach. Me, it'd be a long stretch. That's like today, the guys are.
security cleaned it all out for you. I've got nothing.
I'm one of the old guys there. One guy took some of my boards because I gotta fix some boxes if the forklift hits them and that. I said, hey, who told you could take my boards? What are you gonna do about it, old man? I started running after him, but then he slowed down. Otherwise I probably would have had a heart attack trying to run after him. He's like 30 years old. I'm 68. So it wasn't a fair race. Everybody was laughing their fucks off.
Sunday was.
It makes the job easier.
More having those fire suits on. Oh my God.
You gotta get your.
It's just getting started. My battery was completely dead.
I'll be through this 20 hours.
She's getting the angle. Art, how are you?
Good, David.
How was your trip?
98 degrees with fire suits down there on Sunday.
You don't have to be crazy, but it helps.
I was gonna say, you're looking a little bit more so.
Oh, yeah. Yeah, I was.
That's like a couple of guys come in and to the warehouse there in shorts on. I had a shirt, sweatshirt, and my jacket on. Are you nuts? I says, come along with me. The warehouse, the refrigerator is 36 degrees. I says, you can see your breath in there. Oh, I don't want to go there. It's cold in there, and we were in and out constantly moving potatoes today, grading some, putting some, this and that. So good thing is we only got 43 semi loads left.
That's the little taters, isn't it?
Yeah.
And they're still bagging them. I think they're still processing them.
Oh, they bagged having some of the sized ones that we have Hispanic workers pick out the real big ones that got
Okay,
mixed in there.
It's 6 o'clock, so we'll call this meeting of the Waushara County Board of Supervisors to order. We'll start out with roll call. For those of you who have internet connections.
It's not working.
No.
Not.
Okay, we're all present. So if you rise now, we'll have a silent prayer and pledge allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I think it's working.
Okay, you were all sent an agenda. I would look for a motion to accept the agenda. Okay, moved by Mr. Bossard. Is there a second?
Second.
Second by Mr. Waddle. All in favor?
Aye.
Opposed? All right, and we have minutes from the May 28th, 2024 monthly meeting and the June 4th, 2024 special meeting. You've had those. Is there any additions or corrections to those minutes? If not, I would look for a motion to approve both sets of minutes. Moved by Mr. Peterson, second by Mr. Urban. Is there any discussion? Okay, hearing none, all in favor?
Aye.
Opposed? All right, very good. We did not have anyone register for public comments this evening. We have no unfinished business, so we'll move right into new business. Reports and presentations. First will be the County Administrator's monthly report with our interim administrator, Rusowski.
Hi, everybody. So since the last meeting, we had our soft opening with family and friends and some of the buildings renovation committee members. I would say there was probably about 100 people that walked through. It seemed to be well received. So we're hoping that we will get a nice turnout for the grand opening, which the grand opening is next Tuesday. It's from 4:30 to 8. The ribbon cutting ceremony will be at 5:30. Both judges, as well as retired Supreme Court Justice Wilcox, will be speaking. Sid Samuels from the Samuels Group will be here to give a little presentation. And the Sheriff's Department Honor Guard will be presenting the colors. The ribbon cutting itself will be at 5:30. That ceremony will start, and then the chamber will be there as well. Every department will have people here so that there will be somebody in the department to give tours to all of the public. So I hope that you can make it and join us. We'll have some refreshments and a slideshow going on in the screens here in the conference rooms showing some of the building project. In your packet, there was a letter from Mr. Joseph regarding our screening process. As you'll recall, Mr. Joseph was an individual that is currently involved in a lawsuit with Washington County. That letter was sent to our insurance company and the attorneys handling the case. They are not recommending that we make any changes to any of our procedures. So that has been taken care of. I just wanted to let you know that. And next month, I will be coming to the board requesting a resolution that will be authorizing us to join in the next piece of the opioid settlement. This will be with the Kroger food chain, and their pharmacies have entered into a settlement. And so all of that information is getting compiled, and I'll have that for you for the July meeting. And then once that is accepted, we should start getting payments from that settlement this year as well. And in July, we'll be getting our next payments from some of the other settlements that we already have been involved in. So that's been going really well. We still have a nice savings there that we can continue to use. Recently, we've had a few more people apply for sober living that are clients working either within our jail or within the Department of Human Services or both. So we're continuing to utilize those funds, and I'm very pleased with the process that you adopted and how it's working. I will tell you that we're one of the few counties around who are actually utilizing our funds. A lot of them are still arguing about how to use them. So I think that it's getting out there where we need it, and I appreciate all that assistance. So that's all I have.
Okay, very good report. Does anybody have any questions for Ruth? Okay, hearing none, we'll move into our second item, the Public Health Department Annual Report with our Director of Public Health, our Public Health Officer, Stephanie Eldridge. Nice.
So I don't know why the first slide didn't show up, but I'll just talk it out. So at Public Health, our mission is working with the community to promote wellness, improve health, and ensure environmental safety. Our vision is leading with our county as a trusted resource that promotes healthy families, supportive communities, and safe environments. Our core values are equity, integrity, collaboration, perseverance, and excellence. So you can see all of our staff up here. There are 12 of us. So we truly have a great staff. We have public health experience ranging from 1 year to 15 years. It's a lot of historical knowledge there that we're definitely using. So we are a team that is willing to do hard things and recognize that our attitude, our work ethic, and investing in relationships within this community is what matters and is what will move our work forward. We are a team that is dedicated to the mission and ensures that our decisions are based on the mission. So in 2023, we updated a couple of our plans. So first is our strategic plan. Our four categories are collaboration, communication, capacity, and cultivate. And so collaboration is really about improving access to care and maintaining, building, and strengthening our partnerships within the community. Communication is both internal and external, working on bilingual services, information, branding, community outreach, public perception, and transparency. And these are things that really came about after COVID. We want to make sure we're transparent with our residents. So capacity is our new goal. It reflects the Public Health National Initiative to transform our work into reaching the county population as a whole. So public health staff are prepared to be the leaders in health as we strengthen our knowledge, skills, and collaborate to ensure the necessary tools and resources are available for Waushara County residents. So cultivating will assist our response to the challenges our population faces and will bring a new perspective to public health. Developing and moving public health forward into population-based health initiatives is really the public health 3.0 model, which is kind of a newer model. So we are exploring what makes us great leaders in the community and how we can improve. The next plan that we updated was our community health improvement plan. And I have a picture here of one of the top things, and Board of Health understands this as well. Heart disease is, top every month when we go through our death list. We continue to see heart disease as one of the top causes of death in our county. So our community health improvement plan provides insight to the health issues that impact our community and affects our residents. The top priorities for Waushara are access to care, alcohol and other drug, chronic disease, and mental health. And we have a multidisciplinary team called REACH that implements strategies to meet these goals and objectives outlined in our health plan. I was told to keep it short, so here we are, last slide. Okay, so our greatest challenge is really connecting or reconnecting with and building trust within our community, specifically populations such as the Amish and migrant workers whom we've served at one time. So and in 2024, we're really working on that. We've got some connections going, so we're moving forward. But all our programs and services, all of the data can be found in our annual report, which is on our website, on the county website. So this past weekend I was at a leadership conference, and so I'm just going to close with this, kind of reiterate some of the things that I heard over the weekend. So our team, we are passionate and dedicated to working alongside our friends, family, and neighbors to make a difference in this community. We have learned that how we deal with problems and how we make decisions is detrimental to delivering impactful outcomes for our community. Thank you.
Does anybody have any questions for Stephanie?
Stephanie, do you still deal with the Amish schools?
We do vision and hearing screening there. Yep.
Anybody else?
Connections. We do need to.
Yeah, dude.
Okay. Thought maybe you did. Anything else?
Anybody else? Okay, very good. Thank you, Stephanie. Very good report. All right, we'll move into B, discussion possible motion action item. One is only one is the county board strategic plan. Oh, wait a second. You hear me okay? No, the county board strategic plan that was included last month, and then it was again in your packet. So I guess we can open it up for some discussion, and then or else if you're okay with it, I would look for a motion to approve it.
Were we going to update the logo on the first page? Didn't it say Wisconsin underneath Waushara County?
Yep, okay, yep, that can be done. Anything else on that? Any other, okay, I would look for a motion to approve it. Okay. Motion, is that a motion, Mr. Busser?
Yes, motion to approve the strategic plan as presented.
Okay, motion by Mr. Bossert, is there a second? Second by Mr. Johnson, is there any discussion? Okay, hearing none, then go ahead and vote.
Yes.
Okay, so the motion passes. Very good, thank you. Appointments, there's one for the Human Services Board, John Schwader, from Watoma, June 2024 through June 2027. Is there a motion to approve? Motion by Mr. King, second by Mr. Waddle. Did you want us to vote or just,
It's up to you.
okay, all in favor?
Aye.
Opposed? Passes. Transportation Coordinating Committee, Paula Spielman, Watoma, June 19th of 2024 through May 31st, 2027. Is there a motion to approve? Motion by Mr. Kirschner, second by Mr. King. Is there any discussion? Okay, hearing none, all in favor?
Aye.
Opposed? All right, that passes. Is there any board suggestions for future agenda items at this time? Okay, seeing none. I would entertain a motion to convene into closed session pursuant to statute 19.85 Wisconsin statutes to consider the employment, promotion, compensation, or performance evaluation data of any public employee over which the governmental body has jurisdiction or exercises responsibility. And moreover, it's to review of requested information from HR on administrator applicants and discussion on initial interview scheduling. Is there somebody make that motion?
So move.
Motion by Mr. Waddle, is there a second? Second by Mr. Gray. Is there any discussion? Now, this has to be a roll call vote on this, so. Okay, we'll move into closed session then. So, thank you for coming.